We are now ready to go, so Aaron, whenever you're ready, you can get us started.
All right. According to Obama, the U.S. government should provide universal health care for all its citizens. This act was passed on March 23, 2010. With the Affordable Care Act, everyone will be able to get affordable health care. Insurance companies will have to expect everyone, including someone with cancer, diabetes, or people in intensive care. If you have problems getting the money to pay for health care, you may get a health care reform. Health care reforms are better ways to get affordable insurance. It also gives you more ways or options for receiving quality medical care. The only people not having to buy health care or pay a penalty are people with certain religious beliefs, members of the native tribes, undocumented immigrants, and people in prison. People with no job or low minimum wage don't have to pay for health care too. There's also no penalty fee if you have a gap in coverage for 3 months or less. If people aren't required to get insurance when they are well, they'll wait until they're injured. When they need insurance, there'll be less plans available, and it will be more expensive. Many Americans don't want health care because they think that only when they're sick they will need it. But if you don't have health care and you get seriously injured, the prices will go higher, and all Obamacare is doing is trying to help those who don't have it.
Okay. The topic of our debate is, should the U.S. government provide universal health care for all its citizens? The definition of universal health care is that everyone in society should have easy access to affordable, quality medical care. Lamont will be against this topic of discussion for the following reasons. With universal health care, the lack of competition will lower the quality of research. Universal health care in other countries have failed, and America somehow picks them back up and helps. Our rights don't give us an obligation on any one person to provide any other person with anything. The only obligation we have is to not break the law or violate anyone else's rights. Free health care isn't really free since we must pay for it with taxes. Expenses for health care would have to be paid for with higher taxes or spending cuts in other areas. Government-controlled health care would lead to a decrease in patient flexibility. Over the last few decades, the United States has witnessed skyrocketing health care costs. Health insurance premiums have been rising on average by double-digit percentage points over the past 5 years because of these health care costs.
Can you give an example of that? Of how they've been rising? Like what the prices have raised?
Currently, more than 45 million Americans lack any form of health insurance, and millions more are uninsured. While this problem was a problem to low-income Americans, more and more middle-class citizens are becoming directly affected by the problem. In the face of the rising health care costs, fewer employers are able to provide their workers with health insurance. The percentage of employers offering health insurance dropped from 69% in 2000 to 60% in 2005. In a recent survey, 1/3 of uninsured Americans reported that they were unable to fill a prescription drug in the last year because of the cost. In one study, more than half of the uninsured needed medical care due to financial concerns, while over the third went into a physician recommended medical test or treatment due to financial concerns. Of the uninsured do not have a regular place to go when they are sick or need medical advice, compared to less than 10% of the insured. As a result, 20% of the uninsured say their usual source of care in the emergency room, compared to just 3% of the insured. The potential of earnings profits, investors aren't likely to invest. Another thing to think of is that universal health care will mean increased taxes, whether for the average American, corporate America, or both. Yes.
Back to the employers not being able to provide health care for the employees. With the Affordable Care Act, they wouldn't have to provide it, the government would, so they wouldn't have to provide it.
The American Medical Association makes the point that public health insurance might not be the best way to lower growing healthcare costs. Instead, the AMA believes that driving private insurers out of the health insurance market will likely increase the health insurance costs. The increased costs would then be passed on to the nation's taxpayers.
Okay, the end of the first